Go ahead.
Hello, it's Dr. Herman here, and I'm with a patient of ours. Her name is Gloria Wilson. She lives here in South Florida. Gloria has suffered for, about 30 years with various symptoms that several years ago, at least a decade ago, was it about they called you fibromyalgia?
20 years.
20 years ago, fibromyalgia. With fibromyalgia, pains and symptoms, chronic fatigue, insomnia, gastrointestinal disorders, body pain, and so on. Gloria's been coming in for care now. It's, what is it, about 3 months now you're here?
3 months.
3 months, right? And all the time getting a little bit better and a little bit better. I'm gonna just help you understand what we do, or the types of symptoms or painful syndromes that we treat here. Gloria, you had how many different doctors or what type of physicians had you seen over the past 20, 30 years?
Internist, rheumatology, neurology, gastrointestinal, probably a few that I've forgotten along the line.
So really, neurologist, rheumatologist, internist,
Infectious disease,
primary care physicians, endocrinologists,
Yes.
And were you taking medicines like Lyrica medicine?
Yes.
You took all those kind of things? You were also diabetic.
Right.
And was any physicians with diabetic work actually improving anything that way for you over the years?
No. Every medication I took, I had allergic reaction.
Allergic reactions to the medications.
And my blood sugar stayed the same.
Right, and we're still working with that. That's a little bit of a challenge, but we're only 3 months into this. What type of changes have you noticed so far and people are telling you, what type of compliments are you getting from people out there who know you all these years, who are seeing changes with you?
Yesterday I saw a friend that I haven't seen in, 2.5 months, and I was climbing up 2 flights of stairs, and they came over and they said to me, what has happened to you? I have not seen you be able to walk up 2 flights of stairs without stopping every other step, because you just didn't seem you could make it. And they were so surprised when they saw my face, that my face looked happy and not in pain. And he said that he could not believe how well I was moving, how happy I seemed, and he felt sorry that all these years that I had been walking around like this, and within a matter of a few months that I had changed so drastically.
That's awesome. And going through the airport with all the pains that you've had and difficulty walking and climbing stairs, you told me even recently you
Right,
were
I was
running faster than your husband through the airport.
Right,
You
to
were
the next
surprised with
gate.
that.
And my husband, I take 3 steps to his 1. And
He's
I
a lot
beat him.
taller.
Right.
You beat him. And with the tests that we've run here, I remember hearing from you towards the beginning when we found that with that stool analysis about the absorption problem and the food sensitivities, the reactions you're having. With other types of care that you've been through, the doctors never looked at that information, right?
Right. For
Yeah.
over 20 years, I've been to doctors complaining of a stomach ache, diarrhea, and it was blamed on irritable bowel syndrome due to fibromyalgia, acid reflux. My esophagus was zigzagged like a map. All these different medications, nothing worked.
All the different, was it antacid medication?
Antacid, something to calm the stomach. Different diets I tried, and I was always back to square one.
And right now, how is your function in that respect?
It's wonderful since we discovered that I'm gluten intolerant, and it's not even an issue anymore.
Not even an issue, so there's no like indigestion, no irritable bowels, no issues like that at all.
No.
You have normal function coming out of there.
Right, and I'm not bloated anymore, not gassy.
No more bloated and gassiness. That's awesome. And the pains in your body that you've had, the achiness or the fatigue and so on, how is that now?
That has subsided, I'd say at least 80%.
80% better. And recently, in the past 2 weeks or past week or so, we started a new part of the treatment for you with the cream. Remember that cream that we did?
Right.
The stimulating her adrenal gland. That's not a caffeine stimulation, but helping to stimulate certain functions of one of the systems in the body where we found a malfunction. And you said that you used to feel fatigued or ready to fall asleep by what, 1 o'clock?
1 o'clock in the afternoon.
And now you're...
And now I'm still going. Occasionally I get tired maybe around 4 or 5, but I'm also up at 6 in the morning and running all day, so I think that's pretty
you're
normal.
good for about 10 hours.
Right.
Yeah, no problem. We're going to check back in with Gloria in a little while. Right now I've got to get to work with her, but I just wanted to share with you, there is hope for these fatigue, fibromyalgia, gastrointestinal disorder conditions. It is not a medical mystery. It is if you go to a doctor, whether medical or homeopathic or holistic type of physician who just doesn't get it and doesn't understand that there are neurological imbalances, right? We're doing brain-based therapy work as well as dietary work as well as supplements. So there's a whole neurological aspect that we've got to look at where the brain has a disconnection syndrome where we've got to, so to speak, we've got to recharge up the brain. And there are other metabolic issues that have to be addressed as well. And in this office, that's what we do. We are able to evaluate, is the brain doing what it's supposed to be doing, as well as all the other systems of the body. And in time, people will get well. So there is no mystery to this. And we'll check in with Gloria again to hear about how she keeps improving in a little bit while. But I thank you for sharing your story. And anybody can see you in the office if they come in.
Yes.
Okay. All right, thank you.